Welcome, everyone. In this presentation, we are going to talk about risk factors for anxiety. Anxiety disorders are complex, influenced by a combination of genetic and environmental factors. According to literature, and after reuniting different studies' findings, here are pointed out the main risk factors involved in anxiety disorders. Such factors may lead to learning experiences linked with later anxiety disorders, including direct or vicarious, which means by observation of others, exposure to threats. Students' environment at home is of vital importance. Low socioeconomic status, parental conflict, parental overprotection, or on the opposite pole, parental early separation, and low parental education are negative predictors on what refers to the development of pathological anxiety. Traumatic events such as the death of a parent, childhood maltreatment, or exposure to violence also predisposes to higher levels of anxiety. Even though this is not totally understood, we may say biological factors have a role to play in this field as well, considering there is a certain inheritability of personality traits. It is known that children of parents with mental disorders have a higher probability of developing mental disorders too. On what refers to sex differences in young people, there is mixed evidence about genetic sex differences in anxiety. There are more studies pointing out female sex as a risk factor for anxiety disorders rather than male sex, but results are not consistent. It is important to keep in mind that most of the 15 to 18 years old students face questions like, what am I going to do when I finish high school? Am I going to college? What professional area do I see myself in? Even after they find the answers to all these questions, there is some other challenges. Grades. Most of them find it out if they want to be successful in a particular area, they might have to study harder so they achieve a certain grade. And this is inevitably a risk factor for stress, for anxiety. Even more, if they have some kind of learning disability, which makes the process more difficult. In the past decade, there has been increasing concern over the impact of social media use and engagement with online content on anxiety symptoms and the development of anxiety disorders in children and adolescents. The impact social media use can have varies by gender, age, social media platform, and time spent using. One of the predisposing factors for anxiety is linked to the fear of missing out, or FOMO, phenomenon. There is so much happening on social media, so much new content every day, that adolescents feel afraid of not getting updated on all possible dimensions. Besides, people usually tend to post beautiful moments of their lives on social media, a conquest, an achievement, and when someone is still fighting for understanding what's his place in the world, what he wants for his future, when someone is dealing with feelings of uncertainty, seeing everybody else living a perfect life, even though unrealistic in most cases, this might increase anxiety symptoms. Thank you for your attention.